Uh-oh, what just popped? Oh, recording.
Okay, so you should probably get a message that you're okay with me recording the session.
Okay, and then as far as like time limits, I suppose we're going till 7:30. So I don't want to cut don't want to cut anybody off of responses or whatever, but I guess just keeping in mind the time as well would probably be a good thing. So yeah, I guess we can just walk through what experiences at Augsburg helped you get into dental school.
Sorry to interrupt, but do you want to do intros first, since not everybody knows everyone? And I think especially for Bobby and Jimena, they probably haven't had a chance to meet Abby and Lucas and Amanda before.
Very good point.
Thanks.
Yes. Panelists, would you like to introduce yourselves?
Sure, I can start. I'm Amanda. I went to Augsburg for my last 2 years. I transferred there, and I'm a second year in dental school right now.
I am Lucas. I graduated from Augsburg 2 years ago, and I am also in my second year of dental school at the U.
I am Abby, or Abigail. I graduated from Augsburg in 2018, and I'm also in my second year at the dental school.
Awesome. Okay, now with that, without further ado, I think we can get into the questions.
Does anyone else want to introduce themselves? Like, tell us what year you are?
I can start. I'm Sandra. I'm a third year, and my major is biopsych.
I'm
Go
May.
next.
Oh, sorry.
I'm so sorry. Go ahead.
Oh, it's okay. I'm May. I'm a fourth year, and I'm also majoring in biology.
I'm Soria. I'm a second year at Augsburg, and I'm also majoring in biology.
I'm Bobby. It's my first year. And I'm also majoring in bio as well.
Hi, my name is Jimena. I'm a first year at Augsburg, also majoring in biology.
I'm Isaac. I'm a fourth year student. I'm a bio major, and I'll be going to the U of M this coming fall for dental school.
Yeah. Abby, do you want to start with the first question?
Sure. As you can see, you can also read my answers. So what experiences? I was on the women's soccer team, did multiple research projects. I did URGO in the summer. I was an AugStem leader. I was like a tutor and a SI. I don't know if those are the same thing, but I don't remember. I also studied abroad in Costa Rica, which also had a research opportunity, and then helped start and took part in the knitting class. And I don't know if they do a lot of those things anymore during COVID, but those are some of the experiences that I had.
Go ahead, Lucas.
Sorry. Like Abby, I just did a bunch of research experience, both at Augsburg and at the Mayo Clinic. And then I just participated in a bunch of extracurricular activities. I was on the hockey team. And then what you guys are doing, pre-dental club, stuff like that.
Yeah, I did similar things too. I did some research. I also did study abroad. I was a student instructor for Dr. B. And I also did the Mayo Innovation Scholars Program. Those are the big things I did through Augsburg.
Very cool. Did anyone take a gap year, and what does that look like?
Okay, I'll just start off answering all the questions so you don't get distracted reading them. I took a gap year, which was basically planned for a while because I studied abroad during my junior spring semester, so I didn't want to have to come back and apply right away for dental school. When I took a gap year, I lived in Hibbing because that's where my boyfriend's family's from, and it was cheap to live there. And I originally just started working at Target just because I needed a job. And I reached out. There is a community colleges up there, which as a D4, you can do outreach there through dental school. So I reached out to them to see if I could possibly work for them as like somebody that sterilizes stuff. And they said I could volunteer there. I was like, I kind of need paid. And then I reached out to another dental office, and eventually they had an opening, and I was an unlicensed dental assistant, and I sterilized for them. And I took the time to travel and hang out with my family during that gap year, which was really nice.
I also did a gap year. I think I ended up volunteering, doing more, like spending more time at Hope Dental Clinic, just because I had more time to volunteer there. And then I mainly just worked and kind of did the same thing, just spend time with family. Um, I knew it was going to be like the last year before like dental school, and I'm like, dental school is going to be pretty busy, so I was like, do all the things now before I get into dental school. And yeah, so mainly just did that. But I like taking a gap year. Like I thought that was beneficial, and I don't know how I would have been able to go from I think undergrad to grad school without the gap year. It kind of gave me that time just to kind of like focus and not get too burnt out.
I did not take a gap year. I went straight in. Uh, the summer before, though, before dental school started, I traveled a ton and just enjoyed my summer and didn't work, and just did things that I love to do. Almost done with the second year now, and I'm still not burnt out. So
How do you prepare for the DAT?
Okay, so I use Kaplan Prep to prepare for the DAT. I sometimes kind of use like other online resources. I think like DAT Bootcamp and like something cracker. I forget what it's called. Anyways,
For that.
yes. I actually signed up for an online DAT prep course, and I think it met like 2 times a week online, and then the rest of the time you like completed work in the workbooks. And I chose that one just because it was like cheaper than doing the in person, and it kind of allowed me to work too on top of it. I also signed up for it around Black Friday because there was a big sale on it. So if you're looking at that, because they're not cheap necessarily, but I liked it because it was structured. So I didn't really have to plan when I was gonna like study what necessarily. If I were to change anything, I would probably just give myself more time to study for it because I came back from Costa Rica at the end of May, and then I took the DAT July 17th. So it was kind of a short prep time.
So I did end up taking the DAT twice. And the first time I did Kaplan, and I kept working and volunteering and like doing everything I was doing. And I kind of treated it, I think I treated it more like a class. I was like, I have to know all this information. And then I was like doing so much at the time that like I just wasn't focusing on it like I should. And I think I should have done more just practice exams, practice examples, instead of like treating it like a class, here's the textbook. And I think that's how I treated Kaplan. So the second time around, I took a month off of work, and I literally just studied, and I did that boot camp the second time around because it just had so many like practice exams, full length exams. And I felt like that one worked so much better for me. And it went better the second time around.
I did Kaplan, and if you learn best by just reading and you can retain it, the Kaplan's probably a good option. That's not how I work. Um, I still only took it once, but I did like a Kaplan class once every week, and that was like 5 months before the DAT, which was way too long. I stretched it out way too long. And then by the time I was ready for the DAT, I didn't feel prepared enough. So I delayed my DAT a month and did what these two did and just took a month and treated it like a full-time job, and then took my DAT. But I would recommend taking as many tests as possible. I know you can buy tests without having to buy a whole program or whatever, but because 6 hours, I don't even remember how long the test was, but it's long.
Yeah, I agree. Just like practice, just keep practicing. Like it's not a class, it's an exam. I think that's like where I went wrong looking at it. Because you already know the information at that point. It's more just like practicing it and just kind of like going over the stuff, like repetition.
What made you choose the U of M over other schools, and how many other schools did you apply to? What were they?
Okay, so I applied to 7 schools, which I think was kind of low compared to what some other people apply to. So I applied to University of Minnesota, Nova Southeastern, which is in Florida, University of Illinois, Chicago, University of Colorado, Case Western, Tufts University, and Marquette University. And I got an interview at Minnesota, Nova, and Chicago. And I was waitlisted at Nova and accepted at Chicago and Minnesota. And I'm from Illinois originally, and I came to Augsburg for undergrad, and I did not want to go back to Illinois, but I was gonna go there if that was the only dental school that I got into. And then once I heard I got into Minnesota, I immediately accepted there because I was not going back to Chicago. But also, I really like Minnesota a lot, and Minnesota is a good school, and I was familiar with the area. So yeah, I went to Minnesota. I'm at Minnesota.
I think I chose U of M because I think I just like needed that support system. Like my family, all my extended family lives here in Minnesota. And I just thought like with dental school being so stressful, like I know that I easily get stressed out. And so like having family around was important to me. And then I also knew that Minnesota was a good school and had a lot of like opportunities. And if I wanted to do research or something like that, I knew that they had options for things like that. So yeah, I think overall that's why I chose Minnesota. And I actually only applied to Minnesota the first year because I figured if I didn't get in, then the second year I would add schools in Minnesota. But I figured I'd take that chance just the first year because I just knew I wanted to come to Minnesota.
I applied to 6 schools. I don't remember all 6, but I got into the U in Creighton. I chose Minnesota because location, my family lives here, and then finances, it's a little cheaper to go to Minnesota as an in-state. And you can just build a lot of connections here as well. If you're planning on staying here for the rest of your life, it's a good way to build connections to the school.
Catherine, I think you're sharing your screen, so would you be able to scroll down? Please? Thank you. Okay, what was the hardest section of the DAT for you, and how did you go about preparing for it?
Okay, for me, I thought the hardest section was going to be the perceptual ability, just because it was so different, and we hadn't like learned it before. And I still cannot do the top front end. For the life of me, I cannot figure that out. But It wasn't my worst section. My worst section was actually both the chemistry sections. And I think that was more of I just didn't give myself enough time to prepare for them. So I'd probably just give myself more time. And for the perceptual ability, I used Kaplan, like I said before. And Kaplan, the course that I bought, I think it had like 4 or 5 practice tests. So I would go to the library and just sit at the library for 5 hours and take it like the actual DAT. Because as Amanda and Lucas were saying, I think it's really important to like practice that actual scenario before you do it.
Yeah, I think the same thing for me. Chemistry was definitely one of the hardest sections. And then I think because I probably just didn't practice it enough because I assumed like, I know chemistry, like it's gonna be okay, like and then it just I don't know, it does take just going over stuff. And then I thought the other section was math. I'm good at math, so I was like, I don't need to practice math much. And the thing is, it's so fast that it's like you don't have much time, so you really have to like practice like going fast. And that was kind of where I underestimated the math section. So definitely just I would practice like you speed on that one.
Yeah, I just think it's important to know what your strengths and what your weaknesses are. I was the opposite. I did well on chemistry and math, and I absolutely hate reading, and I scored terribly on reading. So it's just know what you're good at, and maybe don't study as much at that section, and whatever you're not good at, spend more time on.
To add on another thing really quick, I was terrified for the math section because on my practice test, I was getting like 12s on that section. I was like, well, here it goes. I'm going to fail this. And on the actual DAT, I don't know. And in the Kaplan course, they said like they had changed some of the math section to be more graphs. And it was so much easier than any of my practice tests. And that was like my second highest like category, and I was mind blowing. But so sometimes your test is, I think they say like a third of people say it was easier, a third say it was about the same, and a third say it was harder than like any of the practice tests they took. But anyways, yes.
What classes at Augsburg have been the most helpful to you in preparing for pre-dental school?
So I was a biology major, so most of the classes were the prerequisites for dental school. So I would say those are all helpful. In your first year of dental school, you take a lot of those again, like biochemistry, microbiology. So if you kind of remember those things, it really helps you in the long run. My like last year of undergrad, I took knitting and beer brewing and like golf, and those were all really fun. And I think that just kind of gives you like the unique, I don't know, edge to your application, I guess.
Yeah, I agree with Abby on this one. I kind of think like all of them because when you get in, you're taking a lot of those prereq classes that you took. You're taking similar classes again, like neuro and micro, and so it's just having that basic like foundation will definitely help a lot, like through any class you're gonna do in dental school.
One class that I didn't take in undergrad that I wish I would have is anatomy and phys. So that's my recommendation. And then I also took immunology. I took a cancer immunology and just a regular immunology course. And I've found that those have been super helpful along the way too, because immunology is like a super challenging concept and topic. And just having a little bit of background in it has helped me a lot.
I second not taking anatomy, and you should definitely take it if you get the chance.
I second that too. Yeah, I third that because like I did take anatomy and phys, but I took it at I did Century College for my first 2 years, and I took anatomy and phys there. And what we learned there was so different from dental school anatomy and phys. So I think wasn't it Dr. Crow that teaches anatomy there? I would take like a class from him and add that on, or go somewhere else if you have to find an anatomy and phys class at another college, like add that on.
Yeah, because your first semester in dental school, you take anatomy, and it's a 5 credit course, and it's just a beast.
It's yeah.
I know this question isn't on there, but like, what classes are you guys taking like right now, or like your first year, and like how many classes do you have to take each semester? If you guys get semesters, I don't know how it works.
So going in right away, your first semester, you take anatomy, and then you take oral anatomy, which is just dental specific. And then you take like biochem and micro and some other biology courses. Now we're way more dental specific. So I don't know, Abby, if you want to add.
Sure. It's a lot more like elementary school where everybody's in the same class together, like all 100 people, and you're just signed up for all the classes, so you don't pick which classes you're in. And I think each semester we have over 20 credits. I think it's about like 26 or around there each semester. So it's almost like double a semester of undergrad. And we also have fall, spring, and summer semesters. So I guess it's kind of 3 semesters a year, except for your first year. It's technically only 2.
Yeah.
Yeah, like Lucas was saying, the 2 hardest classes basically your first year, like learning all the details about teeth, which there's like 40 different points for each tooth, which you would have no idea. Yeah, like gross anatomy is definitely hard, and there's a cadaver lab for that too. Yeah, and so the general classes, and then like Lucas was saying, like now, like last semester, it was much more lab specific, and we only had a few like lectures, so we were in lab more, like prepping for cavities and doing crown preps and that kind of stuff on our mannequin. And now we're much more lecture based, where we have like, I don't even know, like 5 or 6 lectures every day for a class. And then we only have 1 lab now, but we're starting to see patients now too, like Fridays, some Fridays. It depends like which group you're in. So it kind of depends, but like this, it went from like last semester was kind of nice because we were in lab and doing a lot of lab work, and now it's just like a ton of classes, and it's just, oh my gosh. But
Yeah. So right now, for example, we're taking pharmacology, so learning all about the drugs. We just finished a dentures course, so now we're paired with like 3 students. We get to make an actual patient dentures, so we do that like every other Friday. Yeah, you basically start from like class 1, so operative 1, which is like drilling out different cavities, and then you go all the way to operative 3. Operative 1 is 1 semester, operative 2 is another semester, so on and so forth, and then you learn how to do crowns, and you just build your way up. Mm-hmm. And that I think it gets way more dental specific the start of your second year, which is basically the next summer.
Yeah, because then you add in courses like perio, which is like for the gums. You're learning about gum health. Yeah, and yeah, it's just very dental specific at that time. Like I was surprised last spring we had 15 classes, and I was like, I've never had 15 classes before. So sometimes it's just like keeping track of like what classes you're in. But it's manageable.
Yes, it is.
So does your schedule work like, I know I'm asking questions that aren't on there, but does your schedule, do you take all 15 classes in a day, or is it split up in like Monday and Tuesday you take certain classes, and then like Tuesday, Thursday, Wednesday, Thursday, like how
exactly.
does that, yeah,
Exactly. Yep.
Okay.
So some days are Monday, Wednesday, Friday, although we rarely have class on Fridays, which is really nice.
Yeah.
So it's more like Monday, Wednesday, and then Tuesday, Thursday. And then I remember looking at a question that asked, what does a day look like? I don't know if we just want to skip to that question right now since we're on that topic.
Yeah.
Right now it's way different because we're on Zoom. But hopefully by the time y'all are in dental school, because I know you will, you'll be here someday. Correct me if I'm wrong, Abby and Amanda, but it's kind of like classes from 8 to noon, like in a lecture hall. You bounce around just like high school, from classroom to classroom every hour. Then you have lunch from 12 to 1, and then from 1 to 5 you go in and it's hands-on lab work.
Mhm.
It's about what a day is like.
Yeah. I would
Every
agree.
day you have lab. Lab isn't like on certain days like how it is in college.
So it depends. Like last semester we were in lab 8 hours a day pretty much, and now we're only in lab 4 hours a week.
Yeah.
So it kind of depends on what semester you're in. Like all of us are all certified now to do operative dentistry. We just have to wait till the D4s get pushed out so we can go up in clinic and practice on patients, which will be this May. So if anyone
it's
needs
also-
dental work done, come on.
Yeah, I would. That's basically kind of how it worked before COVID. Now I would say, like, we have our classes are kind of scheduled about 8 to 5, but it varies like each day. And now, like this semester too, like most of the time we would have a class like 1 or 2 times a week, and now we have a class like 3 times a week, and I'm like, I don't have time for this. But and sometimes too, like for one of our classes, we had to watch lecture before we go to lecture. So and most of the time it's like an hour and a half lecture, and then you go to live lecture for like 3 days or whatever. But I would say now I'm probably like doing like Zoom stuff or watching pre-recorded lectures for most of the day. And like Lucas said, we have a 4-hour lab 1 time a week, and we're split up into groups right now because of COVID. So you either go Monday or Wednesday, and then the rest of the week we just have like pre-recorded or live lectures right now. And then Thursday and Friday, every so often you'll have a patient in person as well. That's our kind of our semester right now.
Yeah. And then sometimes like you'll have a class. So like going back to like the 15 class thing, you'll have a class where it'll only be for like the first half of the semester, and then it will end and you'll have another class start. We've had a few of those too. So.
Does anyone else have any burning questions off the top of their head? Bobby?
I have a question, but it's not related to this topic. I was just gonna ask about like your research during undergrad. So I know Abby said that none of her research was dental related. So if could you please talk about what your research was and if you also studied for DAT during those time?
Okay. So my first research experience, I was just kind of helping out with somebody else's research project. And then my next one, it was actually with 3D printing. With I did like 3D printing with like medical dental supplies, but mostly I just like helped with somebody else with their project. And they did like mechanical testing and that kind of stuff. And then my next research project was about Daphnia, which are little water fleas, and I like discovered they have actin in their little like things that they sense stuff with. And then in Costa Rica, I did a research project on leafcutter ants and whether they clean their leaves before they bring them to the nest or not. So none of it was teeth related at all. But I think just like knowing the research process and being involved in that is important. I know Lucas had some dental related research though.
Oh, what a great transition. So my very first semester at Augsburg, I built a relationship with an adjunct professor who worked at the Mayo Clinic. So my first summer, I did research on at the Mayo Clinic on peanut allergies. And then my second semester or second year at Augsburg, I took OChem and I had Dr. Wenzel. And I did URGO with him for a summer, and I don't know if you guys did it, but we did a lab on dental composites and light curing. So I did a whole summer on that, which was fun. But in both situations, the biggest thing I think that you guys can do right now is start building relationships with your professors, because you never know where they're going to lead to. Get uncomfortable with, I mean, it's just reach out and see what they can do for you. And yeah.
Yeah, I agree. I think because yeah, none of my research was dental related either. Mine was in the physics department and it was on sound waves, which doesn't have anything to do with teeth. But I think it's like just about the experience and that experience in itself is just valuable. And I think I know it's kind of tough like with COVID and Zoom classes, but like I thought being an SI for Dr. B was like one of the best things that like I did because I got to know her so well, and she ended up being one that wrote one of my letters of rec. And so if you could do something like that, like be a tutor and SI, it's an easier way to get to know a professor. Um, yeah,
Both both Dr. Wenzel and Dr. Dolence was the guy I did research at the Mayo with. Both of them wrote my letters as well.
Yeah, Dr. Beckman was my advisor and my like mentor for my ergo research, and he wrote one of my letters of rec. And then I know this is one of the questions actually.
Yeah.
I had a biochem professor write mine just because I got close with them, and then a religion professor write one because I was also close with her, and then a dentist that I worked for or like interned for wrote one too at the time.
And Abby brings up a good point there. When you get to that point and you need letters, I don't remember what the question asked, but try and get a lot of variability from the people writing your letters. So Abby just said she had a religion professor write hers. Like, what does that have anything to do with dentistry or anything like that? Because I feel like a lot of students just get like, oh, their biology professor, oh, their chemistry professor to write one. And so I think variability in that is really stands out on an application.
I agree, Lucas. I had one of my other letters was from my boss when I had been working through most of undergrad. It was a family-owned Euro shop, and he and my boss ended up writing one of my letters just because I just formed that connection with him. And so I mean that had nothing to do with biology or dentistry, but it just like he knew my work ethic and how I worked at the restaurant, and he's like, you know, you're going to be good and successful if like if you this is what you want to do, like you can do it. And so yeah, I think just getting to know people and getting that variability is good.
I think some schools have a requirement of either science professors or like an employer or even someone in the dental field sometimes of what their letter recommendation requirements are, but other ones don't, or you can just add more to the ones that are required as well.
The U of M typically requires 2 letters from science faculty and at least 1 letter from a supervisor. But if you have someone that can cover multiple areas and can speak to how well they know you in many different areas, those tend to be the strongest letters.
I have a question about the application process. What was it like, and when did you guys start working on it?
Okay, so I guess you kind of start working on your application way before you actually start working on it. Most of the time, Katharina had me start this early on, like when I started shadowing and volunteering. Each time after I did one of those, I wrote down like how long I was there and just a little about the experience, like what I learned or just what happened. And that was really, really, really helpful when it comes to writing your application, because then you're not trying to like recall every single thing that you've done. That if you're like me, I can't even remember what I had for lunch yesterday. So I probably won't remember what I did like a year ago at a certain dental office and like how long I was there and everything. So definitely do that. That was really helpful. I think I started like actually applying for it or started writing everything. I think I wrote in there in April. And that's just kind of when I started compiling like all my experiences and when I started writing my personal statement. And then when I went to get letters of rec, I think I just gave them a rough draft of my personal statement because I wasn't done editing it. And once I was done with all of that and like compiling everything, my goal was to submit when the application opened or around that time, because most schools, if not all of them, have rolling applications where like the sooner you submit, the more seats there are, and they start filling seats as the applications open. So I think I submitted mine within the first couple weeks of the application opening. So I was working on it for a few months, I would say.
Yeah, I remember Katharina said treat this one like a class too. So I also did take a month to kind of focus on the application, and it took a lot longer than I thought it would. So like having a month was like a good time span because you're writing your personal statement, um I don't know, you're adding in everything. And so I also kept a journal. So whenever I would go and shadow, I would write down stuff. And then I also had an Excel spreadsheet where I wrote like this volunteer opportunity and this date, and so just kind of like my master like copy of like everything I had been doing in undergrad. And then that was a lot easier to write the application because that's exactly what the application is. It's like how many hours did you shadow? And if you don't have that and you don't know, like, it could be hard to like remember that like later on. So yeah.
Yeah, similar to Abby and Amanda, took a lot longer than I thought it would. I think, let's just say June 1st is when application process opened. I didn't take my DAT till later in June, and then it took me till pretty much September 1st to apply. So it took almost a month or two.
There's a question that came up in the chat box, and so let me just put this out there because other people are probably thinking the same thing. But the questions regarding volunteering hours and whether or not schools want to see something that's not related to dental school as far as volunteering, 100 to 150 hours of dental training, shadowing. During COVID right now, it's really hard to find places to shadow. And so most dental schools are making some adjustments in terms of the numbers that are expected. So for people that applied this cycle, we made some slight adjustments. But if you're applying, you probably should have known before you submitted your application that you wanted to go to dental school. So you should have done some shadowing all along. I'm sure this next cycle will probably make some more adjustments in terms of the total number of hours expected, but as a bare minimum, you should have at least 30 to 50 hours of shadowing so that you know what it is that you're getting into. And that's just the bare minimum. So for those of you that are just starting off, you'll still have other opportunities to get more shadowing hours. Okay. And then when you think about volunteering, it's really easy to see who's a checklist applicant. Usually it takes us probably about 3 to 5 minutes to figure out who's just checking off boxes as far as fulfilling experiences versus those that have chosen all their different activities for specific reasons. So if you're passionate about something, pursue it. Okay. If you're thinking about your schools, if there are specific schools that you're applying to that have a very specific mission, for example, if schools are committed to serving underserved populations and that's part of their goal and they have community outreach programs serving those populations, you need to be able to demonstrate that you share that same passion and commitment by volunteering. It doesn't have to be in a clinic setting. You can volunteer as a tutor, but serve those same kinds of populations. You can help at a homeless shelter. You can volunteer with Meals on Wheels, or just think about Campus Kitchen, Augsburg's Health Commons, because those kinds of programs serve those same populations. It does not necessarily have to be dental related. I don't know if any of the panelists want to add to that as well.
Yeah, I totally agree. I think shadowing a dentist for, I don't even remember what the minimum hours were. I think it was like 200 when I was applying or something like that. It's just unrealistic to shadow a dentist for that long and not die of boredom. It's fun to do dentistry like with your hands, but to watch it's not fun. But I recommend, if you can, to shadow and volunteer with a dentist for maybe 20 to 30 hours, enough hours to be able to talk about what you saw, what you learned, what you liked about it, what you didn't like about it. But otherwise, I would volunteer anywhere you can possibly volunteer at.
Yeah, I don't know. To add to that, I don't know like how volunteering is going at Hope Dental Clinic right now, but that was probably one of my favorite places to volunteer because they would let me wipe down the room, which I was like, I'm gonna do something like, and then like I'd get to hold the suction sometimes, which was really cool because like when you go to a private practice, like I mean, which makes sense, they have you kind of just stand there and watch, but like I felt like I got a little bit more hands-on stuff practice in Hope Dental Clinic, which was pretty cool, and I always thought that was fun.
I agree with that too. If they're still doing or when they do open it back up at Hope Dental Clinic, that was super fun because you kind of get more hands-on interaction, which just makes it a little more exciting. And then at least for me, I tend to remember things better if I learned anything. And then I'm not from Minnesota, so I was kind of worried about being able to find like private practice dentist to shadow, but I actually met the dentist that I see now, and I just had a cleaning yesterday. I met him through Hope Dental Clinic. He was volunteering one night, and he asked if I wanted to shadow him at his practice, so I did. And then he referred me to an oral surgeon that I could shadow, and that was cool. I shadowed like an oral surgeon for 3 days in a row. And then I somehow ended up, I think through Katharina, shadowing a pediatric dentist. Was that through you or no? I don't remember.
Yes, you end up seeing the pediatric dentist that I used to take my kids to.
Yeah, so it was kind of fun seeing different specialties too, because I didn't really understand that a general dentist could do everything, and you don't necessarily have to specialize to do like braces. You can do braces as a general dentist, like you can do root canals as a general dentist, like you can do all of those things. So that was kind of cool to like broaden those horizons. And I think I wrote this down in the questions too somewhere, is like Katharina was saying, don't do things to just check off boxes, but do things that like you want to do and that you're going to enjoy doing, not that just it will look good on your application. So if you want to go volunteer at a soup kitchen, go volunteer at a soup kitchen. It doesn't matter, it's not dental related.
Yeah. And if all of you are stuck as to where to start, I hope all of you have a dentist that you see. I mean, ask them if you can come shadow them. I mean, COVID, it might be tough, like Katharina said right now. Hopefully things start to calm down soon. But what's the worst that can happen? They say no, and they're probably not going to because you are their patient. And if you guys are interested in dentistry, they should be more than willing to let you come shadow them for a day. And you can ask them, well, who do you refer for oral surgeon? And then you get leads. And so if you're stuck and just looking for a place to start, why not just ask your own dentist?
Yeah, I agree. That was how I started. I was at my dental appointment, my cleaning, and I was like, can I come shadow? And they were like, yeah, of course. Like, when do you want to come? Like, they're more than happy to have me come. So I think that too, you build a rapport with your dentist and your dental hygienist. And so because like when I come in, like my dental hygienist, I remember one time when I said I wanted to go to dental school, she's like, oh my gosh, let me give you a tour of this entire practice. Like so it's kind of fun to start there, get to know them, shadow there, and then find other opportunities from there, or ask if you can go. Even just calling. There were a couple dentists I didn't know, but I was like, I'm interested in like seeing more about like oral surgery. So like maybe I'll just call this oral surgeon. I actually ended up making business cards with my name, phone number, school email, and I stopped at a couple, like I went in person and stopped at a couple practices that were close to home. And I was like, hi, I'm Amanda, like I'm applying for dental school soon, and I'm interested and would like to know if I could come shadow you at all. And they ended up calling back, several of them, and let me come shadow.
Yeah, the oral surgeon that took out my wisdom teeth, I pretty much asked him at my post-operative appointment if I could come shadow him. He said, yeah, anytime. So just don't be afraid to reach out. And if you guys need help finding someone, Isaac and Katharina have all our emails. We can definitely help you guys out too.
Yeah, feel free to like email with questions or literally like anytime. Like I check my email all the time for the most part. So if you have a question, just don't be afraid. Send an email. I'll do my best to answer it.
So what is your most favorite thing about dental school so far, and what's your least favorite thing about dental school so far?
So as you can see, I have my answer typed out there. So my least favorite thing, at least right now, tends to be the trend of the poor communication. It just seems like sometimes not everybody's on the same page, just between like admin and then faculty and students. And each class has like class presidents and vice presidents and stuff. So they like usually are doing the communicating between admin and us students. But a lot of times, like when we're in pre-clinic, we think we're doing something, and then the faculty come in and tell us, no, you're doing that. And we're like, well, that's not what like the course director said. So it's just that's kind of a little messy sometimes. But my most favorite thing is finally learning about dentistry after so many years of school and wanting to do this. It's really cool to like actually learn this. And it's amazing to think like how much we've learned from day one. Like I can prep a tooth for almost anything now, which is really cool. And our class is super helpful too. Like everybody sends resources. Like if they made a study guide, they send it to we have a group meet with like all 100+ people. So that's really helpful, and everybody's there to help. And a lot of the time, it kind of seems like just in general, the dental community is like a big family, and everybody just wants to help each other, which is really nice.
Yeah, I'd say similar things, Abby. I think sometimes the communication has been added a little bit of extra stress. So that's probably been my least favorite thing about the school. But I think my favorite thing overall is I feel like with every class that's more specific and geared towards dentistry, like I'm liking it even more than I thought. Like I knew I liked it, and I'm like, wow, like I really like it, and I'm like really excited to like go out and practice. And as we learn to do, like as we add more skills, like when we learn how to prep for crowns, and now we're learning about removable partial dentures right now. So it's like learning about all these different unique dental like aspects. It's just like it just adds that extra level, and it's I don't know, it's exciting. It's fun.
The biggest challenge for me getting used to when I started was subjective grading. So in lab, you drill out a cavity or something, and you can show one professor and they're like, that's perfect, A, here you go. And you can go grab a different professor and look at it, and they'll think that's a fail. So that was a huge hump to get over and get used to, because there's no right or wrong answer. It's all subjective. Like I said, one professor might think it's great, the other one would not accept that at all. So that was the biggest challenge for me. And then my most favorite thing is just learning what methods and skills work best for me. Dentistry is unique because everyone does things differently. So if you ask Abby what burr does she use when she drills out a cavity, she'll probably tell you 245. I use a completely different burr. Like it's very cool, and dentistry is just a unique. Dental school is very unique in that way. So.
What made you decide on dental school, and what was it worth the ride?
Okay, so definitely worth it. Still super excited and love it a lot. I wanted to go into dentistry since I was in middle school. I'd always known I liked the health field, and then after I had braces I just really liked that experience. And so I started like focusing all my time on dentistry. I don't have any like family members who are dentists or anything, and it seems like a lot of our classmates do, or at least like parents, grandparents, whatnot. Um, I just became I really liked teeth for some reason, and I still do, and I'm here. So yeah, it's worth the grind.
Yeah, I totally agree. It's definitely worth it. Um, I I've also known for a long time that I've wanted to do dentistry. Like I had really bad teeth growing up, and so they were crooked. I took a certain medication that also like weakened the enamel when I was younger. I was really sick, and so just didn't have good teeth. Had trouble like enunciating words. Couldn't chew certain things, and so then I had an expander and then braces, and so I was basically like having dental care all the way up. And so I spent a lot of time at the dentist, and I knew that I wanted to do something in the healthcare field because I knew I just wanted to help people. And so I started talking to my orthodontist about dentistry, and he loved his job. Like I could see how much he loved it, and I was like, yeah, this could be something that I could do. And so I also like the aspect of a dentist is able, if you start a private practice or join a private practice, you have a little bit more control over like what you can do for your patients. So like in a hospital setting, it's like if a patient doesn't have insurance, it's like you may have to turn away someone. And like maybe at my own private practice, I'd be able to write it off. And so I really like the idea of being able to make those decisions and calls, which I knew was something you could do as a dentist. And so I just continued to look more in dentistry, and I was like, I think I'm gonna go for dentistry.
I did not know I wanted to be a dentist till probably halfway through my years at Augsburg. I wanted to go to med school. I shadowed some doctors, and they basically said it's not worth it. They don't like their life, basically, which was kind of shocking. So then I was stuck because I took all these pre-med courses, biology major, didn't know what to do. So then I got put in touch with a dentist, and she was talking to me about it. And she's like, why don't you just come shadow me? And I was like, I don't even like going to the dentist. I'm not going to come shadow you. And she talked me into it, and I ended up falling in love with it, and I have no regrets. So, what was the other part of that question?
Was it worth it?
I'll let you know when I'm done. No, I've grown such a huge passion for dentistry. It's really weird. I don't know how or why, but Abby and Amanda, I'm sure you feel the same. All we
Yeah.
think about is teeth. But yeah, it's definitely worth it.
How are you planning on paying for dental school?
Okay, so I am kind of in a unique situation compared to most of my classmates. Pre-COVID, we used to have like loan lunch and learns where you learn how to like pay off your loans, and I would just go for the free pizza because I don't have any loans, which is really nice. I'm on a scholarship through the Navy, and the Army and the Air Force also have this scholarship where you can apply for it, and they pay for. I am on the 4-year one, so they pay for all 4 years of my school. And they also reimburse me for books, and I get a monthly stipend as well, or I should say books and supplies. So like my $2,000 pair of like magnifying glasses, they reimbursed 1,500 of that, so that was really nice. Um, but so if you want to do something like that, I would say definitely start looking into that early because there's only so many of the scholarships. And then after I graduate, I will be a dentist for the Navy for 4 years to like pay back my schooling. But in my opinion, it is so worth it because dental school is so expensive. And I actually shadowed a couple Navy dentists too before I applied for the scholarship, and I absolutely love it. I played sports, and it really reminded me of being on a team, and it was really cool because like all the specialties were in one building and there were like 40 dentists in one building. So I was really cool. And the dentist could go to like the endodontist and be like, hey, I have this patient, like, what do you think I should do? Or they could go to the endodontist and be like, hey, I want more practice with root canals. Like, can I work with you on some of your cases? And so to me, it's just a really cool opportunity and I'm really excited for it.
Yeah, I took out loans. I don't have a scholarship right now, but I'm definitely like looking into like different things I could do when I graduate to pay it off. So I'll let you guys know if I figure it out.
Yeah, I'm also taking out loans, and I plan on practicing rule. So I know there's some rule repayment programs, but we'll see what happens.
And the other thing is that it's extremely common to take out loans, right? So people shouldn't really be afraid of that.
Yeah, that's the thing. Dental school, or there would be a huge shortage of dentists if dentists couldn't pay back their student loans. So just keep that in mind. It's definitely, you'll be okay.
With the average salary that dentists make, you can repay back your loans. So that shouldn't be a worry as far as having to take out loans. There are probably more scholarship opportunities available right now because of that shortage. And so watch for those kinds of opportunities. The other loan repayment programs, if you're willing to work with underserved populations, rural areas, oftentimes on reservations or areas that tend to serve underserved populations. There are loan repayment programs available through HRSA. I can never remember what the acronym stands for, but it's HRSA. And so if you just Google them, you can find out about some of those loan repayment programs. And typically you apply for those while you're in your last year of dental school. And I know we've had some of our past speakers that have spoken to the club that have earned those scholarships. One is Mycie Moa McDaniel. She's working now at North Point Health and Wellness Clinic in North Minneapolis, which is an underserved area. And so she's part of that loan repayment program. So she doesn't have to pay back any of the loans that she took out as long as she works in that clinic for a certain number of years.
You guys answered that one. Like, how's your relationship with faculty? I think you guys kind of answered that.
Yeah, and I'll just say this: COVID isn't helping anything with the communication. Before COVID, we were totally fine. So hopefully things go back to normal soon.
Yeah.
Because administration also are practicing dentists, so they have a life, and it's kind of tough to balance that. So
That was gonna be one of my questions. Sorry, I was gonna ask, how were you able to balance schoolwork like during your undergrad and then now during graduate school, while like your social life with school? How were you able to, or how were you able to balance?
So I guess I was pretty busy in undergrad as well. But I don't know, just like in dental school, your first semester, they kind of ease you into it. And we at least we had a lot more free time than I thought we were going to, which was really nice. So definitely take advantage of that at first. But then there's different times. So like now I feel like there's not even enough time in the day to get all of our schoolwork done. But I am a person that like needs a social life. Otherwise I will go insane. So most of the time you just kind of have to make time and you sacrifice other things sometimes. But like most of the time on the weekends, I'll do something like for myself or with my friends or whoever. Sometimes on weeknights I can do stuff. In undergrad, I played soccer, so it was kind of similar. Like I had to get certain things done before I had games or whatnot, but I tended to have better grades during soccer than out of soccer just because you had to have like good time management during it. But so I mean, it's hard, but you do make time for the things that you find are important. And yeah, sometimes you have to sacrifice other things. But I mean, I still get a good amount of sleep every night, and I'm still able to, sorry, like hang out with my friends and my family, and also get my schoolwork done. Surprisingly.
I don't know. I feel like I'm always doing something school related, but I try to take off like one day during the weekend. Like no matter how crazy my schedule is, I try to first of all always like cook something for myself. So that way I'm like not skipping meals or ordering out. And then I try to take one day during the weekend where I'm like, I'm not gonna like think about school, look at school, and then during the week, I think my social life looks like studying with friends. So that is your social life as of lately, I feel like. But there's just a lot to study for, a lot of exams, a lot of classes. So and like when I go to visit my family, I am studying. Like while we're doing movie nights, I'm like studying in during the movie. So I don't know. It's kind of tough sometimes, and sometimes I'm better at balancing it than other times. But I don't know, I think it just depends with the semester because like we were saying earlier, like last semester was all lab based. So I really didn't do a good job balancing because I just felt like I was always in lab and then doing homework, studying. And then this semester is more lecture based and I'm home more. And I think I found a better schedule for myself this semester. So I'm definitely balancing things better. So I think it just kind of changes like with the classes that we're taking too.
Um, yeah, I think it's somewhat similar to undergrad, in a way that, there's a week or two out of every semester where you just get slammed with exams and it's just cram time. You have no social life, and it kind of lightens up for a couple weeks. And that's kind of dental school. I feel like during those light weeks, you have more of a social life. And then when it's midterms week or 2 weeks, not as much of a social life, but you still got to find time mentally to take a break and stuff. But yeah, I think definitely your schedule and social life fluctuates. So sometimes it feels like you're not even in school, you have so much free time, and then sometimes it's not the case.
Was the hardest part about your journey getting into dental school? And I think Amanda already answered that question about the DT the second time, but yeah.
So for this one, I kind of already answered the DAT stuff. I took it once. For me, I think like getting lost in like checking off the boxes is the hardest part because your goal is to get into dental school and to be a dentist, but at the same time, you don't want to like lose the big picture of why you want to be a dentist. And just try not to get lost in just checking off the boxes. I just like I found that was kind of hard to do sometimes just because you're busy with so many other things. You're like, oh, I need to do this for this reason, but it should be more of like, I want to do this because of this reason. And also, I was just gonna say really quick too, off of the like faculty question earlier. I like in undergrad, I was a lot closer with our professors just because our classes were so small, and I was pretty close with, I would say, all of the professors. That like even my freshman year, my calc class, I slept through an alarm during, and it was a day of an exam, and that had never happened to me in my entire life. And I was sprinting to class to take the exam, and everyone on my soccer team was making fun of me because they thought I was running to my second period. And when I got to the class, the professor, the first thing he said to me, he asked if I was okay because he thought something had happened. And that to me, like, never would have happened at like a bigger university. They'd be like, sorry, like the exam's over. And he was like, it's okay. Like, and he let me take the exam during lunch hour. And I was just amazed. I was mind blown. And during like dental school is not really like that, especially for our like lectures. The lectures are so much bigger. Like it's all 100 of us. So most of the time, the professors don't know our name, and they're usually teaching other classes too. Or our lectures will have like 1 to like 6 different people that give our lectures. So we have like guest lectures and stuff. But I would say, like with pre-clinic, you get pretty close with like your bench instructors and stuff because there's only 10 of you on a bench usually that you kind of share. And then in that way, you get close with them. And we're not really in clinic yet, but I'm sure then once we're in clinic, like we'll get even more close with our faculty member is like checking our work and stuff once we start working with patients. So I wouldn't say you get super close like with your professors, but I think with the faculty members, you have like a good relationship with them and they kind of look at you as your colleague. I know that wasn't this question, but I just wanted to touch on that.
I'd say the hardest part was probably just all of it in general. None of my family members are dentists, and so I knew I wanted to be a dentist, but I just didn't know how to go about it and where to look and where to find the resources. And I had started off at, like I said earlier, a community college, and so they had a few like pamphlets on U of M dental school, and I was like, that was about it. And then it was kind of like me doing my own research. So I think it really, really helps like when I got to Augsburg and I met Katharina and she like talked to me about like, these are kind of the things that you would want to do or look at and think about doing. And I knew I had already been shadowing, but beyond that, I just didn't know like, I guess like how to achieve like getting into dental school, I guess. So yeah.
Yeah, the hardest part for me was just learning about the application process. And there's like a big portal that you can send to all these different schools. And then each school has a separate section you got to fill out. So just learning how to navigate that and knowing if I even applied or not was the toughest part, just because it's so new and we've never seen anything like it before. So I really urge you guys to use your resource that is sitting with us today. And I know we're kind of making dental school seem overload and stressful and whatnot. But one cool thing that was said to us at our white coat ceremony was, we're no longer in school for us, we're in school for our patients. So everything we learn is for the benefit of our patients, not for us. So grades no longer matter. You still have to learn it and be good at it. So just to kind of take a little bit of pressure off, you don't have to get straight A's to be a dentist in dental school. You have to do well in undergrad, obviously, but yeah.
I 100% agree because like sometimes like when you're trying to get an A, it's easy to just kind of like memorize things for the exam, cram, and then like forget it all. But like I don't know, like if you get a C but you actually understand the content and maybe you just like spent time getting to know different things, it's still like as long as you understand the content, like that's good enough. Like
Yeah,
it's
you're
not
much better off.
yeah, you're gonna be better off. Like take the time to learn it and don't cram it. Try not to. It's kind of hard because we do have a lot of exams, but like still try to take the time to actually like learn it and yeah, don't worry about getting C's. It's yeah.
Yep. That's one of my pieces of advice I had is C's truly get degrees. Like the person with the worst grades in our class will also be a dentist. And that's okay. That's good. Like they still passed all their classes. And as Lucas was saying too, like in the beginning, it's kind of hard because you're used to trying to strive for like the best and get A's, and you kind of start stressing out about that. But then you just have to accept like, okay, it's fine. Like I don't need these grades. Like yes, if you're trying to specialize, you need like decent grades, but you still don't need like straight A's. Like people, like one of the oral surgeons at their school who taught one of our classes, she didn't have like straight A's and she wasn't at the top of her class, and she still got into like an oral surgeon program, and because she was like a well-rounded applicant. And that's another thing too, sorry, as Lucas was saying earlier about our white coat ceremony, that we're doing this for our patients now. When I find myself stressing out, it's usually because I just really want to be a good dentist and be a good dentist for like my future patients. So some of the times like I'm like I could care less about that exam, but it's frustrating because I'm like I want to know this material. And in some classes I feel like we're not like learning, like sometimes we don't like learn it to the like fullest potential or whatever. And I just get nervous that I'm not going to be like the best dentist that I can be for like my patients, which is kind of a totally different outlook on it than undergrad, I guess. But that just kind of, I guess, happens once you start dental school.
Any other advice?
My biggest piece of advice for you guys right now, I know some of you are in your first year specifically, just build relationships, build connections, and then follow them.
Yeah, I would say, yeah, I agree with that, Lucas. And then I think also don't give up. Like if it's something you want, like just because if you don't get in the first time, like don't give up. Like keep trying. Figure out like expand what you're doing. Like maybe shadow more, volunteer more, learn more about the profession, and just keep trying.
Do you guys have any specific advice for Isaac starting in the fall? How hard was it to collect teeth? You know,
The teeth collecting thing is not as big of a deal as they make it. We've maybe used 3, and Isaac, I have a million for you, so don't worry about it.
Yeah, you can have all mine too.
We'll start using them more like in endo, but yeah, like you could just ask your dentist or someone to like keep a jar at their office, and when they extract teeth, then they can put them in that jar, or even like an oral surgeon or someone. But most people have a ton and they can share with you if you need any.
Yeah,
Go ahead.
Oh, sorry. I was gonna say, yeah, I ended up driving around to a bunch of oral surgeons, and I was like, hey, like, could I is it possible like for you to keep a tooth jar for me? And it was funny because a couple of them had no idea like what I was talking about, and they kind of looked at me like I was really weird because I was like, can you keep teeth for me? And I explained that I got into dental school and this was gonna be for dental school, but yeah, I ended up having a couple offices collect them for me. So that was really nice. And then I just went to go, they called me when they thought the jar was full enough, and then I came to pick it up.
So yeah, you can do that. Otherwise, I'll just give you mine. But biggest piece of advice for Isaac and anyone else going into the summer before, just have a stress-free, relaxed summer. Whether it's working but doing something fun, like I coached hockey, which I love, and made money doing that. Travel. Don't even think about going into a dental office unless you're getting a cleaning. Just be stress-free and enjoy your last summer of freedom.
That's what everyone's telling me. I was like, should I really be, like, I want to prepare, I want to get in there. I want to, maybe even like assist or something if possible. But everyone's like, no. You can't like fully prepare. But maybe that's a good thing because you can enjoy your time with the people you have now before you you know, get get into things fully. So that's really good advice.
Yeah.
You'll definitely be
read.
fine.
Yeah.
Especially too, like I remember we had like we only had like a couple of classes like for the first few weeks, and everybody studied like crazy for our first exam, and everybody did really good for our first exam. And you have a lot of free time like the first like few weeks to a month before more classes start, and definitely take advantage of that because it's really nice to have that free time and do other things. You don't need to study as much for those histology exams as you think.
Yeah,
um
they
yeah.
definitely do that on purpose. You're meeting 109 new people. They want you to build friendships and stuff like that. So you only take 1 or 2 classes the first 2 weeks because they know you're about to meet 109 new people and you're gonna go hang out with them at night and stuff like that. So COVID pending, but
I was kind of worried since I had taken a gap year. I was kind of worried about getting back into it. And in undergrad, I had taken all of my notes just with notebooks and writing like handwritten notes. And I tried doing that for the first couple of weeks of dental school. I was like, okay, this is not going to work. I need to find a different solution. So I ended up buying a iPad Pro, and I really, really like that so far. And I use Notability as one of the apps, and that's been really nice because I can organize everything by semester and then have all the classes and all the notes, and then you can record the lecture while you're writing it, so then you can go back and like re-listen to it if you miss anything. And I definitely like that, and that's how I've been doing all that.
and I will say too, May and Sandra, I don't know where you are at in the application process, but if you guys are writing your personal statements and want someone else besides Catherine to take a look at it and get some advice, you can email us or Google Drive us in it. I know I helped Isaac I don't even know if that was a help, Isaac. You're probably better.
No, it really was. It really was. Sometimes, sorry, I was just going to say sometimes when you're writing something for a month, you just get stuck in your own thoughts, and your wording is just so like stagnant. And so like Lucas really helped me out a lot this summer just by reading it over, letting me read his, and just giving me some pointers and tips about how to say things or whatever else. So definitely take him up on it.
Yeah, thank you. I'll definitely need the help, all the help I can get with that. I'm gonna be starting it hopefully soon, maybe around like March or April. So yeah.
Sounds good. Yeah, Isaac and Katharina will give you our emails, and don't be shy.
Yeah.
I had one quick question about housing. Is it that you just have to kind of find housing independently? I know there's like 2 dental, is it fraternities? Or like dental houses that people do, and that's usually like a cheaper option. How did you all get like the housing that you have, and do you like it?
So yeah, you can definitely check out the fraternities. They're like $300 a month to live in. And then one quick thing while I'm on that topic, financial aid. If you take out the max financial aid, Isaac, I'm not sure. You said you're getting some scholarships, so it might be different for you, but you get $9,500 for about 4 months. So you have to kind of do the math on what you can afford and what you can't, with groceries, living, utilities, all that fun stuff. I probably chose the more expensive living option, but I'm still here, so I'm making it work. But yeah, and then if you want to live with Amanda, what are you doing?
Mike Madden, his son, John Madden, one of our professors, his son owns a couple rentals, and our professor himself also owns some rentals. And I ended up talking to his son John about like any openings at like the place that he rents out, and he rents it out for $550 a month. So it's very affordable. as far as like other places go, and it's about it's on Hennepin Road, so it's about like not even a 5-minute drive to school, and I could walk, I guess, if I wanted, and there's a bus. And so because the first year I ended up commuting, and then I was like, maybe I should probably like find somewhere a little closer, just so it's since I, especially because we were in lab so much, I was like, it might be nice just to be there, and we had late nights, and so I definitely have liked living closer to campus. But no, this is like an affordable option, so definitely just like asking around too.
Mhm. And one of your classmates or class representatives, I don't know, Feardoffs did it for us. They'll make a Facebook group of all 110 of you, and that's usually where people start finding housing together. So I think ours came out spring, maybe.
Yeah, we've had a couple like webinars, so we've gotten to meet some of the other classmates and stuff, and we just created the Facebook page now. So
yeah, so I'm sure people will start reaching out then.
yeah, I'm on there like constantly trying to figure out who are gonna be like, my classmates and everything, just trying to see who's who. But
Yeah.
Some upperclassmen too sometimes post in there because they're like, say they live with a bunch of other dental students and they're moving out, so then you can like take their spot in like this group house. I was gonna say also, if you're interested in living one of the fraternities, it's best to reach out early because the spots fill up quick. I'm a part of one of the fraternities, but I don't live there. And usually I think people end up living there because they know somebody who lives there. So it's kind of, they fill up quick, like depending on how many people leave and whatnot. But I think that is definitely the cheapest option. And then some people still like commute like from home or whatnot. I live just in an apartment. I've switched apartments from last year. Me and my boyfriend just split rent, so
Yeah, if you don't have a significant other to live with, I would definitely live in the fraternity. It's cheap. You don't have to worry about parking. You can walk to school, and you're always around students. So if you need help with studying or you have any questions, it's nice. If you're interested, it's not like a fraternity, bro. It's a dental fraternity.
it's a study fraternity.
Yes. And yeah, if you're interested in that, I also have people I can give you their number. So
Thank you. That's really helpful. Thank you all.
yeah. Any last minute burning questions?
I think that's time. Well, with that being said, thank you guys so much for taking the time out of your busy schedules to give us some knowledge. That was super helpful, and I'm sure all of us have learned a thing or two. Yeah, thank you so much, guys.
Absolutely.
You.
Actually, I'll just throw my email in the chat right now. If anyone wants to write it down and has any other questions, they can just email me. I feel like this is just the easiest. I don't know if Abby in a minute, yeah.
Well, thank you all. If people have follow-up questions, if you don't get their email addresses copied down, just let me know, and I can certainly put you in contact with them, especially when it comes time to following up on questions. We do have some other alums that are practicing dentists as well, and so sometimes instead of shadowing, if you want to do an informational interview, oftentimes that might be even more informative as far as some of the practical information. You're not going to be able to see the hands-on kinds of things, but at least it might be another helpful visit. So we can certainly put you in contact with our alums as well. One is in a private practice, one is in corporate dentistry, so it's nice to get some diverse perspectives as well. Any last questions? Okay, well, thank you all so much. I really appreciate the time that you spend with all of us, and always your insights are so important and so helpful. So thanks again. Stay warm this weekend.
Yeah, you too.
Thank you. Take
Thanks, everyone.
care.
Thank you all.
Yeah.
Thank you.
Yeah.